Do you know what HPV is?
Yes. HPV, it's the most common sexually transmitted infection. And a lot of people who have it don't know that they have it because a lot of the time it's asymptomatic.
Oh, yes, you're right about that. And you know what it could lead to?
It can lead to cancer, can't it?
Welcome to Your Body, the healthcast that takes a deep dive inside your health. No matter what kind of health issue you're experiencing, whether it's the common cold, a bad case of eczema, heart disease, or breast cancer, it affects you in every way, physically, mentally, emotionally, and internally. This podcast seeks to understand what is going on with our bodies from the inside out, from our heads to our toes, and everything else in between. We're going to look at health issues from every angle and hopefully get a better understanding of what's going on with our bodies and how we can better take care of them. I'm your host, Stephanie Landon, editorial manager at RadNet, a leader in outpatient imaging services and an advocate of patient empowerment for over 35 years. There's a virus that almost everyone will get at some point in their lifetime. This virus doesn't produce symptoms. It doesn't make you sick. You might not even know you have it, but it can lead to cancer. This virus is the Human Papillomavirus, or HPV, and it's the main cause of cervical cancer, as well as anal cancer, and increasingly mouth and throat cancer. HPV is spread through sex. In fact, it's the most commonly spread sexually transmitted infection. The Centers for Disease Control, or the CDC, estimates that nearly 79 million people are currently infected with HPV, and about 14 million people become newly infected each year. As I said before, HPV is the main cause of cervical cancer, but it also causes other cancers, including cancer of the vulva, vagina, penis, and anus. It can also cause cancer in the back of the throat. And yet, no one really talks about HPV. Doctors don't really discuss it with their patients. Patients don't talk about it with their doctors. Schools aren't teaching about it in human development or sex ed classes. There's this weird taboo or stigma around this virus, which could potentially have a significant impact on your health. So why aren't we talking about it? Do you know what HPV is?
I don't.
Do you know what HPV is?
Isn't it a blood disease?
Do you know what HPV is?
Is it I think it stands for the Human Papillomavirus, something like that.
Close. And do you know what that is? Like how you get it?
I just know that a lot of people clear it when they're younger on their own, or that's what I've heard. And
Do you know how you get it?
I think you're born with it, no?
Obviously, it seems like there are a lot of people who do not even know what HPV is. Maybe you've vaguely heard about it. Maybe you've heard about a vaccine for it, which there is, by the way, for kids starting at around ages 9 or 10. Or maybe the whole idea of it makes you a little uncomfortable. So let's just put it all out there. Let's talk about HPV. As I said before, HPV is a sexually transmitted infection. You can get it by having vaginal, anal, or oral sex with someone who has the virus. It also spreads through close skin-to-skin touching during sex, and a person can pass the infection to someone even if they have no signs or symptoms. You can get HPV even if you've only had sex with one person, and it can also take years to develop symptoms, which makes it hard to know when you first got it. In most cases, HPV will clear up on its own, but in some cases, the virus will lay dormant and eventually cause genital warts for some types of HPV or cancer. It can literally take years or even decades to develop these diseases. There is no way of knowing who will develop cancer or other health problems from HPV. And currently, the only way of testing for HPV is through a pap smear, which a lot of women routinely get during a gynecological exam. As of now, the only way to test for HPV is through a tissue swab. There is no blood test for HPV. What is really concerning is that the number of mouth and throat cancers caused by HPV in men has recently surpassed the number of cervical cancers in women. So if talking about HPV and the cancers it causes makes you squeamish or uncomfortable, try to remember that we're not really talking about sex. We're talking about a virus, and we're talking about cancer. And when you know the facts, you can do whatever you can to better take care of yourself and your loved ones.
So what happened to me was that I knew that I had HPV in my 20s because my gynecologist said, you have a regular cell, which is HPV, and you have to come back, and we're going to do something called a colposcopy, which is where they look at the cell, closer under a microscope.
Right.
Which I did. And then, and it comes back either, negative or positive. It came back okay. So that's it. I was good to go.
I'm talking to Lillian Kreppel. She's a survivor of anal cancer due to HPV, and she's made it her life's mission to promote education and awareness about HPV. After her cancer experience, she partnered with the actress Marcia Cross, who also had anal cancer, and together they founded the HPV Cancers Alliance.
Nobody really said anything to me about worry, about anything. I thought they're just checking, for cervical cancer. Fast forward to 4 years ago when I was 54, or 53, I don't remember. I started to, over the summertime, I started to feel like I had a hemorrhoid. And
right.
I know what a hemorrhoid feels like, but this particular, what I thought was a hemorrhoid, was not going away. And it seemed like it was getting nastier. And then I noticed that there was blood when I went to the bathroom.
Right.
Number 2.
Right.
I'm just
yeah.
laying it all.
Well, you know what? You have to, I think, right?
Yes,
Yeah.
you do.
Yeah.
So I had blood, and I thought, and then it was consistent. Not a lot, but it was every day.
Right.
So I went
That's
to see
unusual.
my gynecologist.
Yeah.
Yes. I went to see my gynecologist, and she did a rectal exam, which, by the way, they all should be doing, and they're not all doing it. She did a rectal exam.
Okay.
And she said I was fine. And I said, I'm not fine. And I ended up going to see another doctor who then did something called an anoscopy, which he said this is going to be the most embarrassing test ever. And it's like, he puts a scope up your butt. And
right. And what kind of doctor was this, the second doctor?
He was my gastroenterologist.
Okay.
And I trusted him. I liked him. Not that I didn't trust my gynecologist,
right.
but I was like, there's something wrong.
Yeah.
So when he was finished with that exam, he did not look at me, and he said, tomorrow we have to go for a sigmoidoscopy. And I said, well, what's that? And he said, well, it's like a colonoscopy, but they look at the anal canal. And I said to myself, something's up, because he didn't look at me. And so the next day we did the sigmoidoscopy, and then he came over to me and he's like, it's not the best news. I was like, what?
Yeah.
And he said, you have a malignant tumor. And I was like, what am I doing with that? I'm healthy. I eat right. I do this. I exercise. He's like, I don't know, but we're going to take care of it. It's treatable. So that's all I paid attention to. I just paid attention to treatable,
right, and
going forward.
Right.
And
that had never entered your mind prior to that.
No.
Right.
No.
Right.
So I then, I don't know how much more you want me to tell you, or take a break or whatever. But, I ended up going for 6 weeks of chemo and radiation at a hospital in New York, well-known cancer hospital, and they were fantastic. And I was really positive, and I had a list at home of all the dates, which it's a certain protocol for this type of cancer. It was 6 weeks of chemo and radiation, and I put all the dates down. And every time I went for a treatment, I would cross off a date and say, okay, 25 more, 24 more. And
oh my gosh.
The doctors, I had a big party after, and the doctor thanked the doctors and the nurses, and they said at my party, they said, oh, did this woman know she even had cancer? What was she so happy about all the time? So positive. Because I was like, my friends came with me. I had a chart. Well, I had a different friend every day come with me. I think that I wanted to feel they helped me normalize it, because if I was sitting there in the waiting room by myself and looking around, I'm like, what am I doing here?
Absolutely.
How did I do it?
Well, attitude goes so much into your healing process anyway. So that's
what the doctors told me. Yeah.
Yeah.
Because I'm like, wait a minute. If I walk outside this cancer building, I'm normal. I'm on the street. I'm normal like everybody else. So what am I doing in here?
Yeah.
So I literally just had different friends. I put a calendar. They all filled in when they wanted to come. And I'd be like, come on, this is my radiation room. This is what happens over here. And the doctors are like, what is going on with that girl? What is she so damn happy about?
During Lillian's treatment, she began educating herself about HPV and anal cancer. She also started volunteering for the Anal Cancer Foundation. And it was then that she realized that if she had been so blindsided by her own diagnosis, there must be so many people who feel the same way. She felt like she had to do something.
What led me to create my organization was the lack of education and awareness around HPV, not only on the public side, but on the medical side.
Right.
That, it's not HPV cancers are not on the doctor's radar. Cervical cancer is, but that's it. There's 5 other cancers with HPV. There's vaginal, penile, vulvar, oropharyngeal, and there's anal.
And
there's
anal.
5, and then you got cervical, which is 6. But everybody pays attention to cervical.
Why is that, do you think? Why is that?
I think it's because there's a lack of knowledge. I think there's also a stigma, big stigma. And so part of this was, oh my God, there needs to be education around this. There's a gap here.
Yeah.
And then the other part was very distinctly, I remember one day I was in the waiting room waiting to get radiation, and there was a lady sitting next to me, and she was crying. And I said, what's going on, blah, blah, blah. And she said, oh, everybody that comes into this waiting room, they have their gowns on, they all have breast cancer. I'm the only one with anal cancer. And I said, no, come on, I have it too. I go, we're going to be fine. We're good. We're good. And she looked at me and she said, no, I am stage 4. It went to my lymph nodes.
Oh, yeah. And
then I asked her, what did your doctor not feel like? What happened? And she's like, the doctor thought it was a hemorrhoid. And so, I went home, and then months passed. And so this is the common story, that the doctors, they're not aware of it. And by the way, I went back to my gynecologist and I said, hey, I've been with you a long time. I like you. I just want to tell you that I didn't say you, but this was this. And I asked my gastro, what did you do? Because I want to know what you did that my GYN didn't do. And he said, palpated. So he went with his fingertips and he found a hardening that's not supposed to be there. That hardening, everyone thinks was the hemorrhoid, but no, that was the tumor. And she really should have caught it. And when I went back to her and I said something, she said, it's not my area. We're not trained. And at first I thought that is not acceptable. But then when I listened to all the patients that call me and everything, that's the norm. They are not trained. They do not palpate. And so I said, what were you doing when you did a rectal exam?
Yeah.
And she said, I was checking your ovaries from behind. She really should have caught it because it was
that is what they do, right?
Yeah. So then it's like, no, this is a no-brainer, and I'm not embarrassed. I don't really care what anybody thinks. Like this happened to me. It can happen to you. Let's get with it, people, and let's get out there. So that's what led me to start the organization.
Well, what do you think can be done to ease the stigma around it?
So what I think is, there's a stigma about HPV, and there's a stigma about the cancers, especially like anal, vaginal.
Yeah.
There's a woman who just passed away. She was very famous in the fitness world, 57, never went to the doctors, and never got, and ate only organic, just passed away from vaginal cancer. Wouldn't talk about it. So what I think is, number one, HPV needs to become more of a household name, like going for colonoscopies. Colonoscopies, well, I don't know if they're sexy, but they're at being, like I got a postcard in the mail, 2 postcards. You got to get your colonoscopy by 45 now, because colon cancer is on the rise. So we need to make HPV a household name, and that's the first thing. And the second thing is, like, I've had women in their 60s come up to me and say, "Can you help me say anal cancer? I don't say it. I say colon cancer." And I said, well, you know what? You're not doing anybody good.
Yeah.
You need to say what it is, because it is what it is. And, you didn't do anything wrong to get anal cancer. And that's the other stigma, because people think, you're having anal sex, so that's why you got anal cancer. And I'm telling you, gynecologists have said this. A, none of your business. B, you don't get it from anal sex. So
it's just a sort of a matter of where the virus, where the cells develop, right?
Yes. And why can't they go to the back? They're in the front. Why can't they go to the back?
Yeah.
And by the way, Stephanie, I used to think, because I hear from people all over the country and the world, and I used to think, oh my God, these doctors from Oklahoma. But no, the doctor on Fifth Avenue in New York City, the doctor in Madison, same thing, no different. Because of what happened to me, all of my friends now ask for a rectal exam.
Yeah.
Well, many of their doctors say, well, no, we don't do that here. Why don't you do it?
Yeah.
So this is something that we are working with ACOG, which is American College of Obstetrics and Gynecologists. We really want to see about updating guidelines, and really we want to work on some type of a campaign that, hey, people, please get, like, this is serious. And it's right. It's there. It's the most pervasive virus. So why don't we know more about it?
I think another thing that really stands out to me is something that we try to talk about a lot on this podcast is knowing your body. Like, you knew that it wasn't right. Even when you're like, I think a lot of people, like that woman that you met, the doctor said, oh, it's just a hemorrhoid. And you probably would go home. A lot of people would go home and say, okay, it's just a bad hemorrhoid. But you knew that it was more than that. And I think that is another thing that's so important, is like, your body. So sometimes the doctors are not always right.
Right. That's a good point. I knew something was wrong, and because I was in pain. I mean, I knew, and there was something. However, I will say this, and you're right. A lot of people, when they go to the gynecologist or the doctor, and the doctor says you're okay, they're good. They want to leave. They're like, okay, good. I escaped that. But I will say this: there's many people like Marcia Cross had no symptoms whatsoever. She was just going for a routine gynecological exam.
Okay.
She got so lucky, because she wouldn't be here today if her gynecologist didn't say to her, I don't like what I'm feeling, because her gynecologist palpated and she found something, and she told Marcia, you need to go to the colorectal doctor now. And Marcia was like, what? I have to pick up my kids from basketball practice. And with me, I had symptoms and was told I was told, you don't always have symptoms. So you just have to know your body. But in the case of Marcia, she just got really lucky. Yeah. And so, I would tell people, ladies, keep up with the yearly PAP and ask for a co-test, which is the HPV test.
And what is that called again?
Co-test.
A co-test. Okay.
It's like what they do for a PAP.
Yeah.
They do test for HPV.
Okay, and that's not something that they regularly do?
they should be doing it.
Interesting. So you should ask if they're doing it.
Yeah, you should ask for it. Not get,
okay.
And they should get a rectal exam.
Yeah. So let's talk a little bit about your foundation, the Farrah Fawcett Foundation, to start with.
Yes. So Farrah Fawcett passed away due to anal cancer. And and my president, Alana Stewart, will have more details on that experience. But we came into this with anal cancer as understanding it as a rare cancer, which it is. But we didn't even understand that it was 90% caused by HPV. Farrah was never tested for HPV, which we find so interesting because at that time in 2006, when she was diagnosed, it wasn't as obvious a link that HPV, which is not cancer, is a virus that can turn into or lead to cancer. And so you ask yourself, and so anyways, Farrah, once diagnosed, wanted to make a difference. And she created the foundation. I've been here since we started. I am the director of communications and programs. We've learned a lot about HPV, its connection to these 7 cancers, and what can be done.
Christine Romeo is the director of communications and program director for the Farrah Fawcett Foundation. Remember Farrah Fawcett? She soared to fame in the 1970s when she starred on Charlie's Angels on TV, and she became a national sex symbol when she appeared on that swimsuit poster in the red one-piece bathing suit with her amazing mane of blonde feathered hair. I remember when I was a kid, every boy, I think, that I knew had that poster hanging in his room, and every girl wanted that same Farrah Fawcett feathered hair. I mean, she was an icon. But in 2009, Farrah died of anal cancer after a 3-year battle with the disease. And before her death, she founded the Farrah Fawcett Foundation.
We have patient assistance funds to help those struggling with cancer. We do a lot for research. Alana can get into that with you. But some of what I do, if I can just jump right into it, which is my passion. We all have our own passions. I don't want anyone to freak out because they found out they had HPV. Look, 80% of the population is going to have HPV at some point in their life. We don't want people to be running around scared. I've gotten phone calls from girls crying, oh my God, I just found out I have HPV. And they think it's cancer.
Right.
Now, HPV is like getting a cold. There should not be a stigma around it, but there is. You want to know, what do I do if I get this HPV thing? And ladies, if you've ever had an abnormal pap smear, that is HPV. Now, your body can clear it in a couple of years in most cases, but you want to make sure your immune system is up. So you might want to take vitamin C, or you might want to take, because people don't know, what can I do? Keep your immune system up, watch your drinking, just live a little healthier maybe, just because you want to, and you always want to do that. Because your immune system has got to clear it.
Sure.
Folic acid is one of the things. And by the way, I'm not a doctor. I'm talking to you from information that I have gathered. So those are the types of things you want to do. What I'm more concerned with, do you have any questions up to this point for me? Because I know
keep going. Keep going. I'll jump in.
Because I'm pretty chatty. I'll just keep going unless you stop me.
I will. Don't worry.
Okay. So again, not to alarm people or have them freak out. So one of the things that I'm most passionate about is, making sure people understand HPV itself isn't cancer. It can lead to cancer.
Right.
If you have an abnormal pap smear, that is HPV.
Right.
Mark your calendar, make a note of it, because according to Dr. Joel Pilevsky, who we work with, HPV can reactivate later in life.
Right.
Due to normal immune slowing down, due to an immune compromised situation. Let's say you have something else you're struggling with, or a high stress situation and your immune system's down. That's when HPV can, quote, reactivate, according to Dr. Pilevsky.
Interesting.
Because I always wondered why, and by the way, I'll openly say I've had a couple of abnormal pap smears myself, so I took it personally to understand, how does this work? So that's
most women have.
Exactly, at some point, and then you go once or twice, but that's why we're saying it's so common. There's nothing to be ashamed of. There is no stigma connected to it. So anyways, in that sense, you want to stay on your pap smears. especially after 40. And what I'm hearing is many OBGYNs tell old folks like me that they should go to the routine PAP exams, their screenings, every 3 years.
That's correct.
Now that you're old, like me, go every 3 years. And I want to say, no.
Yeah. Yeah.
Especially if you know you've had an abnormal PAP. Just go every year, no matter what they say. I just mentioned one thing that's important in my messaging is anal cancer. Farrah had anal cancer.
Right.
People always assume, and let's get graphic, folks. Here we go. Anal cancer has nothing to do with anal sex.
Right.
A stigma is that's what people think.
Right.
It's because the HPV virus lives in the mucosa and it travels based on the anatomy of a woman.
Yeah.
Those bodily fluids move around.
Yeah.
And that's normal. And that's how it may travel to the anal cavity. That's how that happens in most cases.
Right.
And the numbers, which is I find so interesting, is more women than men have anal cancer. It's more women.
Yeah.
It's about 9,500 cases of anal cancer in the United States, which is considered rare as colon and rectal cancers.
Yeah.
Remember, anal cancer is at the end of the tract. Those are specific places. And by the way, cancer doesn't care where.
Right.
It just goes wherever it's going to go. So we'll get past that. But men, 3,100 men and about 6,200 women, almost double the amount of women diagnosed with anal cancer because of the HPV virus and that traveling.
So are women more susceptible to the virus? Because men can get it too.
Of course. So in general, and poor Michael Douglas, who is my hero, who brilliantly and bravely came forward to try and spread awareness. And unfortunately, his PR team, I'm not sure where they were. Maybe they were on a coffee break at the time he came forward. But it was so important what he said. And my plea is that he will come out again and chat with us at some point. Yeah. Hi, Michael. We're here waiting for you to help us in our plight, because this is what's so important. In 2020, the number of head and neck cancers in men caused by HPV surpassed the number of cervical cancer cases in women. So today, more men are affected by HPV-related cancer than women.
Wow.
And that's a big thing. Well, let's see what's going to start happening, because head and neck cancers are on the rise, and more men being diagnosed than women. How do they get that virus? It's oral transmission. Right. That's how that happens.
Yeah. Yeah.
And so, you know, that's a really important thing for people to understand. It's not like, and the other thing is the history of the virus. So it's not like your wife had something to do with it. Again, you could have contracted that when you were 19 years old. Yeah. It lays dormant. Immune response, you know, the sort of reactivating of the virus later in life are the reasons why that might happen. It has nothing to do with that person you're with today. We just don't know. No one's ever going to know. Yeah, right. You know, right. So that part is really important. So our messaging isn't so much about vaccine. You'll see a lot of HPV agencies talking about vaccination, and that's fine. That's for long term. That's for 50 years down the road. But what we try to do is talk about people that have HPV infection today that don't understand it. That like Lillian was shocked to find out this thing and I feel for her, because I mean, so many people don't. We just need to understand abnormal pap smear means you are at a higher risk for anal cancer in the future. Just a higher risk doesn't mean you get it at all. Just stay vigilant. So if you feel something abnormal in that cavity, in that area, and it doesn't feel like a hemorrhoid, or there's a symptom of bleeding, don't ignore it. Talk to your doctor. And if your doctor says, oh, it's a hemorrhoid, but your gut tells you, I'm scared, get a second opinion. Because you had HPV, you never know. It's treatable. It's very, very treatable. But if you wait and ignore, that's where you're going to get into it.
Absolutely. So that's something we talked about.
Stuff. Yeah. That's important.
Yeah. Knowing your own body and trusting your gut.
Correct.
Absolutely.
Yeah.
That is really important.
So, we're concerned with creating a protocol for the OBGYNs to talk to patients and say, hey, have you ever had an abnormal pap smear? Okay. Because we change doctors. Right. But they don't have a set protocol. We can't really figure out why. Not every woman needs to go every year to get a a pap smear, if she's never had an abnormal one, and she's been with the same partner. But the other thing people don't want to talk about is divorced women. So you've been married, you get a divorce, and now you're back on the dating scene. What do you do?
Right.
I mean, that's an area for concern, and sometimes that's where you want to talk to your doctor. One is using condoms actually helps reduce the chance. It is not 100%, but it definitely reduces the chance.
Right, because it is also spread orally.
Correct.
Right.
And that too. So that's something you want to, keep in mind.
Yeah.
And then, so there's that kind of awareness that we want people to have is what can you do?
Farrah was diagnosed with cancer in 2006, as you probably know.
Yeah.
And it was a shock to all of us, and obviously very much so to her, because she was such a healthy, vibrant person. I mean, she was the last person in the world you'd expect to get cancer. So, I always say cancer doesn't play favorites. It's something that I think we've all learned.
After speaking with Christine Romeo, I wanted to learn a little more about Farrah Fawcett and her personal experience with anal cancer. I went back and read the obituary that was written about her in the Los Angeles Times after her death in 2009, and I found it interesting that her cancer was referred to as a quote-unquote rare cancer. And while it's true that anal cancer is rare, I'm not entirely sure it would be referred to this way 16 years later after all we've learned. The truth is, she really was the first to speak up about this kind of cancer, and she wanted people to learn from it. So now I'm speaking with Alana Stewart. She was Farrah's best friend. She was by her side during her battle with cancer, and she's now the president of the Farrah Fawcett Foundation.
After she was diagnosed, she started the foundation, but didn't really activate it because she was busy fighting for her life. And, her intention was that she was going to run the foundation, and her friends, including me, would be part of it and be on the board. And we talked a lot about what she wanted to do with it on our trips to Germany and things. And we started going to Germany in 2007 because there was a doctor there in a clinic that did some very cutting edge cancer treatments, not necessarily alternative, but treatments that were approved to do in Germany that hadn't been approved yet here.
Right.
So we would go there. We went there, I think, half a dozen times, and sometimes we stayed for 3 weeks, and it was quite an adventure. And some of it, strangely enough, was we had good times considering the seriousness of what we were there for. But Farrah had an amazing attitude about cancer. I mean, her feeling about it was that she was going to fight to the end, and she fully expected to survive it. And we all expected that as well.
Yeah.
No one thought this was going to take her down. And there was a lot not known about her type of cancer. She had anal cancer. It metastasized to her liver. And so after she died in 2009, we officially opened the doors to the foundation, and they asked me to be president and CEO. And I had never done anything like that. And I thought, I'm not sure I know how to do this. And a good friend of mine is Sherry Lansing, who's one of the founders of Stand Up to Cancer, along with Katie Couric, a group of women. And we had lunch, and she said, sure you do. She said, you're smart, you'll learn, and she was right. I learned so much, and I already had learned so much about cancer.
Oh, I'm sure.
And one of the things that was important at Farrah, she wanted the foundation to support cutting-edge research for cancers that we didn't know all that much about, and anal cancer is one of those cancers. And one of the things we learned a few years afterwards was that most of anal cancer, I think 95% of anal cancer, or 90%, is caused by the HPV.
Wow.
Human Papillomavirus. And at that time, when she was diagnosed, no one ever really diagnosed her with HPV. It wasn't even, part of the issue.
That's so
that's
funny. Because I feel like they had the vaccine then for kids, right?
Well, they have, but you know what? I didn't know anything about it. I didn't even know what it was. So she was never formally diagnosed with it, but most of anal cancer is caused by HPV.
Sure.
When we did our first partnership with Stand Up in 2013, it was originally going to be an anal cancer translational research team because they didn't have one. And then we said, well, you know, so they're very interrelated, all of these HPV cancers. Why don't we expand? And then we can cover all of the cancers that are caused by HPV.
Yeah.
So that's how we ended up expanding into the HPV cancer awareness and prevention and research. And I think that's been such an important thing to address, because literally in 2010, 2012, I remember people would say, what's HPV? I mean, most people really didn't know, people that were sophisticated.
Right.
They didn't know there was a vaccine for it. A lot of parents didn't know.
Yeah.
So I think we've come such a long way since then.
Yeah, we've come a long way, but it seems like we have a lot longer to go, or a lot further, right?
Yeah, absolutely. And then we kind of segued into the current translational research team that we're working on with Stand Up, which is head and neck cancers, because they're on the rise, and they've surpassed cervical cancer now. And
so crazy.
And you know, we feel, I say this in layman's terms because I don't, you know, not in scientific terms, but there's a feeling by most doctors that that they're interrelated, HPV cancers. So if they find a cure for HPV anal cancer, it's probably going to translate to head and neck. And so that's the new team we're working on now, and we're very excited about it.
Right. So you guys are really actively working on like new research and cures and interventions and that kind of thing.
Oh, yeah, absolutely. And that's part of our mission statement, is cutting edge research. And the other part of our mission statement, which Farrah felt very strongly about, was making people more aware of cancer prevention, you know, advocate checkups and those kind of things are so important, because if she had when she started having symptoms, if she had gone to the doctors then, she might be alive today, but she didn't. She didn't address it right away. Her mother was dying at the time in Houston, and so she was spending the time in Houston with her mom, and she was there for a number of months, and she kind of ignored when she had symptoms that one would ordinarily go to the doctor for. Yeah. And by the time she finally went, she had a very, very large tumor, and it had already probably started to spread, which is a very sad. So that part of the mission statement is very important to us, the prevention and awareness.
Yeah. So is there anything else that you would want people to know about HPV?
Well, I think that it causes, one of the facts that I find most people don't know is it causes 5% of the world's cancers. And it's a preventable cancer, and there is a vaccine, and we're not vaccine advocates per se, but what we do advocate is knowledge, is being informed, is I think all parents should be informed about what HPV is, about the cancers it can cause, and then they need to make an informed decision whether or not to vaccinate their children. I certainly did, and I would recommend it to people, but they have to have all the information made available to them. And I think up until this point, there hasn't been that much known about it, or widely available, or in the schools.
Right. Yeah, for sure. That's definitely true. So what about, go ahead.
I just wanted to say one other thing that was important to Farrah was she was able to afford alternative treatments and to to go to Germany, to do a lot of things that the average person can't do. And so she wanted to, in some way, help people that were battling cancer, that were in financial crisis. And that's another thing we do. We have patient assistance funds in different institutions around the country, and they have social workers at the institutions who, people that are in need that can't pay for their parking or their food or their hotel room while they're getting treatment or have to travel long distances. So we help out in that area too, which
that's amazing. Yeah. That is really amazing. So how can people find the foundation? Like, what do you want to let us know?
Well, please, it's farrahfawcettfoundation.org, and there's a lot of information on there. We have links to other organizations that are involved with HPV cancers. We have a patient advocate who people can actually correspond with, people who, she had HPV anal cancer. Mm-hmm. And there's a lot of information on our website. People can donate if they want. And one of the things I think that's great about our foundation is Farrah left a large part of her estate to the foundation. And so all of the donations that people give us go directly to research, to patient assistance funds, to prevention and awareness. So we don't have to run the foundation
right.
on people's donations, which right. I think is nice for people to know.
Yeah, that's great. What an amazing thing, and what an amazing tribute, to her. So is there anything about her?
I think she would be really proud of what we've been able to accomplish. Sometimes I don't really kind of take it all in, because for me it's become a full-time job, and right. I never really I would never have foreseen myself doing this
right.
at this stage of my life, but it's been an incredible journey, because I feel her presence all the time with us. I feel like she's watching over us, and when we have to make decisions, I always think about, well, what would Farrah do? What would she do if
right.
this were up to her?
I am a nuclear radiologist with RadNet, and predominantly read and oncologic imaging within nuclear radiology, which consists of PET scans as well as a number of nuclear medicine studies. Mm-hmm. In regards to head and neck cancer specifically, we're predominantly talking about FDG PET CT, which is a very common study performed for looking at the primary tumors and staging of these tumors, looking for metastatic disease, whether it be regional near the primary tumor or distant, which can change how the referring and treating physicians might approach therapeutic options.
Okay, and these are the kind of imaging exams that you would be using for someone coming in with like an HPV-related head or neck cancer. So up to this point, we've been talking a lot about HPV and anal cancer. But cancer of the mouth and throat caused by HPV is also pretty significant. These cancers affect the tongue, tonsils and oral pharynx, the gums, the floor of the mouth, and other parts of the mouth. The American Cancer Society estimates that this year there will be about 54,000 new cases of oral cancer and 11,230 deaths from this kind of cancer. What's also significant is that these cancers are twice as common in men as they are in women, and the numbers are rising. Additionally, there has been an increase in the association between these cancers and the HPV virus. Now, is this new association because we know more about the virus, or is there some other factor at play? To start getting some answers, I called Dr. Aaron Gould-Simon. He's the medical director at Valley Metabolic Imaging in Fresno, California, and an assistant professor at Stanford University in the Radiology Department's Division of Nuclear Medicine and Molecular Imaging.
So there's a number of imaging studies that get utilized for these head and neck cancers, predominantly CT, MRI, and PET-CT, and or a combination of the three. Typically, CTs and MRIs, when possible, will be performed with what we call IV contrast or intravenous contrast, and that's just an agent that we radiologists administer to help us differentiate tissues within the neck or the region that we're looking at. Gives us a better visual. Most patients can receive it. However, some patients that have renal insufficiency or kidney issues, sometimes we do not administer IV contrast, so it is a case-by-case basis. And for a lot of these tumors, we can perform CT and or MRI. It just depends on the specific case. And then PET-CT is often also utilized, both in initial staging as well as in follow-up when patients are post-treatment, to look at restaging treatment results and to kind of guide further management. PET-CT, when it's utilized, is very good at looking not only at the primary tumor, but looking for nodal metastases, or these are lymph nodes where the cancer has potentially spread to in the neck. They can be small or large, and so PET-CT is very good at picking out some of these smaller lymph nodes that might be missed otherwise. And so a lot of these head and neck primary cancers, often arising from the oropharynx, the base of tongue, or the tonsils, they can spread to regional lymph nodes when they've had kind of early spread. And then PET-CT is also used to look for distant disease. We typically perform it from the head to the thighs for these types of cases. So you get a whole body snapshot. And so we're not only looking at the neck and the regional structures, but we also scan through the chest, the abdomen, and the pelvis to look for any spots of potential distant spread, which would alter a patient's kind of prognosis and also their treatment strategy. And so predominantly, since we're talking about head and neck and HPV-related squamous cell carcinomas, if they do spread distantly, they often can go to the lungs. So we look for things like pulmonary nodules. But in addition to the chest, we kind of scan the rest of the chest and pelvis like we talked about. So if it has gone elsewhere, we cover that area as well.
Oh, that's so interesting. I didn't know it can go to the lungs. That's interesting.
Yeah.
So is it, as a general rule, do you do that kind of scan where you're looking at the distant areas, or I'm just curious, what determines which sort of scan?
Yeah, so in general, they'll usually perform, when I say they, the referring physician overseeing care of the patient will often have a CT or an MRI done early on. If a patient's having a complaint, that might lead to a CT or an MRI of the neck per se, or potentially they've already, had a complaint and maybe they've been scoped and found a mass in the base of tongue, or the lingual tonsils, or the palatine tonsils, or somewhere else along the oropharynx. And if that's the case, that may lead to a CT or an MRI of the neck, which will give the physician a better sense of, maybe how large this mass or tumor is, and if there's been, regional spread that they can detect on that. Usually by that point, or certainly by the point that you have a biopsy and you know that someone has a squamous cell carcinoma or a primary head and neck cancer, they'll also often order a PET scan. And the PET scans are typically performed of either the skull base down to the mid-thighs, or in primary tumors of the head and neck, will often include the entire head. And then for some tumors, we also do a whole body scan from the head to the toes. But it's always at least covering kind of the skull base region all the way down to the mid thighs. Wow. So these are pretty large field of view scans. To search for spread of tumor and make sure we don't miss something. Right. Wow. So we've talked to a couple people about anal cancer as the cause of HPV, but not so much about the head and neck stuff. So do you know where that cancer can originate in the head and neck area? Sure. So there's cancers can originate really anywhere throughout the head and neck, but when we're talking about HPV
right,
related squamous cell carcinomas,
Mm-hmm.
we're typically looking at the aerodigestive tract and the oropharynx, most commonly involving the tongue base or the tonsils. So those are the most common sites that we're going to look for. But other places could certainly also arise within the oral cavity, elsewhere in the tongue or other structures. So, but most commonly that's where we're looking, and then there's a little bit of a different distribution, whether it's HPV related or HPV unrelated squamous cell carcinoma. They have some variations in how common they are in certain locations, but in general, those are the primary culprits.
Mm-hmm. I was reading something that said that throat cancer in men has become more frequently diagnosed than cervical cancer in women, again, talking about HPV as a result. Is that something that you've seen or you've heard about as well? Can you talk to that at all?
Yeah, I think from my perspective, I have seen and heard some data similar to what you're alluding to, and from my perspective as a radiologist, we're usually seeing these patients after they've been diagnosed and they're being staged for their cancers. We see a lot of both. In my particular field, I read PET CT, and so we perform PET CT for both staging of cervical cancer and head and neck HPV-related squamous cell carcinomas. But I would say that we have seen a rise in general in the number of head and neck cases in men, and certainly the number of HPV related versus HPV unrelated cases that at least qualitatively seems to be increasing.
So you're a fellowship trained nuclear radiologist.
Correct. Yeah, I did a fellowship in PET CT, and so that's really my area of expertise.
Okay. And so what do you think about the benefits of somebody seeing a fellowship-trained radiologist versus a general radiologist?
Yeah, I think it's certainly helpful to have additional training and subspecialty training, and also to see radiologists or a group of radiologists that are experienced and have a high volume of whatever disease process or body part that's being assessed. Radiology is a very large field, right? We cover the whole body and every disease process, whether we're talking about head and neck cancers or mammography or any other number of imaging studies related to it. And so that's just a very large breadth of knowledge for anyone. And so having somebody that sees a lot of particular entity is very helpful. At RadNet, we have a very large oncologic group of radiologists, a very large group of radiologists, and that read a very large number of oncologic cases. We probably have some of the largest case volumes of PET CT of any group anywhere, and even within that, we have subspecialty readers even within our PET CT division. So a number of readers that only read head and neck cancers, other readers that focus more on body imaging, and then different readers for say unrelated to cancer, but PET CT of the brain for things like dementia, et cetera. So having these subspecialty readers who see a large volume of certain topics and are really focused on that and trained in that can really be beneficial for patients, picking up the nuances of certain disease processes, and can be very helpful to the referring physicians and subsequently to the patients and their outcomes.
Anal cancer is the classic example. Anal cancer is not a very common cancer, but it's one of the kinds of cancers that is highly treatable and frequently curable. But because it causes a fair amount of discomfort and, the word shame is not right, but certainly embarrassment or some kind of a discomfort. It's not necessarily good dinner table talk. It makes it a little bit harder, and people are more reluctant to seek attention. And one of the things that we try to spend a fair amount of time doing is demystifying and taking some of the emotion and some of the insecurity out of some of the language so that people feel comfortable talking to us about sensitive topics in sensitive parts of the body, because this is one we can actually do really well with if we are communicating and we are aware of what's going on.
This is Dr. David Hoffman. He's the medical director of Tower Hematology Oncology and a professor of medicine at Cedars-Sinai in Los Angeles. I reached out to him for a little more information because even though I felt like I had learned so much from my previous conversations, I still felt like I had a lot of questions, maybe even more than I had to start with. I actually spoke with Dr. Hoffman on another episode of this podcast, and he graciously agreed to speak with me again for this one. He has become one of my favorite people to talk to because he has this great way of speaking, and he's so knowledgeable, and he really has a great way of making sense of complicated subjects. And he also doesn't seem to mind me bombarding him with questions.
The viral link to cancer is really interesting because what it means, as you know, is in some cases, cancer is an infectious disease, which almost sounds like fiction, but that's the truth, that these cancers, and so we're talking mainly about cancers of the anogenital tract, so that's anal cancer, penile cancer, cervix cancer, some vaginal cancers, and then, of course, the notable exception is head and neck cancer. These are really caused by infection. And what's even, and we'll talk about this more, I'm sure, later, is what's even more interesting and becomes out of the realm of fiction and more into the realm of science fiction is there's a vaccine for this, right? So this is sort of, in some ways, the dream of cancer prevention is to make a vaccine that will prevent cancers. And so this is a tremendous step forward in the science of oncogenesis to understand and prove that these subtypes of HPV, which is a ubiquitous virus, actually cause cancers.
Right. Yeah, I mean, from my reading, I saw that the HPV is the most commonly spread sexually transmitted infection. But I guess in a lot of cases, the body gets rid of it on its own, but for some people it doesn't. So why is that? Why do some people get rid of it and some people don't, and then it leads to cancer?
Right. I think that's a great question, and I think it's been a perplexing one because you're right. The virus is ubiquitous. Everybody comes into contact with HPV, and for most people, it's just cleared by their immune system. For some people, it stays inside, and it can stay dormant for years, decades, and reactivate at strange times. So just like you were saying, we just saw a really nice guy who had genital warts in the 1960s when he was in Vietnam, and now, fast forward a half a century later, he has anal cancer, and it's the same virus that has been there for this entire time, and we don't know who clears this virus and who doesn't, and why it reactivates in some people and why it stays in hibernation. It's a really interesting virology question.
Yeah, it really is. So I'm going to jump ahead some of my questions, but so let's say you have HPV, and as you said, it can stay in your body for years. Is there anything you can do to prevent it from becoming cancer, or you just sort of know you have it and you're like a ticking time bomb?
Yeah, so remember, there's many different subtypes of HPV, and even among the subtypes, there are variants and mutations. Some of the subtypes are really innocuous, and some of them are much more suspicious for being drivers for cancer growth. Mm-hmm. So I think that so if someone has, for example, genital warts, those are the kinds of things where you need to be monitored and tracked. So, there have been attempts at doing things like anal pap smears, but, remember that HPV is the driver of cervix cancer. Right. And that's one of the cancers of the few that we do a good job with screening, mm-hmm. where you screen with things like pap smears and can really be on the alert for changes that are going to evolve into an invasive cancer. So I think that making sure, so there's a certain stigma that that's hard to overcome, of course, especially in things like anal cancer. Just even saying the word anal cancer can make people feel uncomfortable. Right. But trying to overcome some of the stigma of genital warts and what's traditionally considered a sexually transmitted disease, those barriers have to sort of come down, and there needs to be good communication with healthcare providers that this is the kind of thing that is preventable as long as you're monitoring.
Yeah. Well, you just touched on so many other things that I was going to ask you about, but definitely the stigma is one thing that I discussed with other guests. Going back to early detection, right? So yeah, women who get regular pap smears, I mean, they have a good chance of catching something early, but men, not necessarily so, right? Or women, anal cancer. So they're really,
there's no established screening test for anal cancer. It's correct. So we know that in some subpopulations, like in people with HIV disease, there's sort of an exaggerated risk, and especially in anogenital intercourse, there's going to be an increased risk. So there has to be an awareness, at least on the part of the population, that these kinds of viral infections and these kinds of warts that look just like regular warts have the potential to harbor a mutation that can cause a cancer. But there is no real standard screen.
Yeah. Yeah. Do you think that primary care doctors or gynecologists should be doing more?
Well, they certainly need to do more in terms of education. Primary care doctors are in a hard position because there's a shortage. They're certainly squeezed for attention and for time. And with the advent of EMRs, for the better and for the worse, the primary care doctor's time has become so limited. And the truth is, especially in these somewhat sensitive topics, it takes time, and it takes building trust, and it takes a relationship in order to feel the safety and the comfort that it takes to kind of to address these issues. But yes, I think that the burden does fall on the primary care docs and on the gynecologists. Yeah.
One of the guests that I spoke to who had anal cancer, her gynecologist told her that it was a hemorrhoid. She just knew that it was more than that and went for a second opinion. But I can only assume that happens often.
It's not an uncommon story, and I think it's the same kind of thing where if you don't think about it, you're not going to recognize it. So, we have that old saying, the mind can't know what the eye doesn't see, or the other way around, the eye can't see what the mind doesn't know. So if you're not thinking about it, then you're just going to miss it. And, an example is penile cancer. Penile cancer is a rare disease, but if it's on someone's mind and there's the right setting, it certainly has to be something that can't be missed.
Right. Yeah. And I was also reading in current research, it shows that throat cancer in men has become more frequently diagnosed than cervical cancer in women. Mm-hmm. So why is this happening?
Well, I think it's, it must have something to do with the host environment. But head and neck cancers in men, out of proportion to head and neck cancers in women, are becoming more prevalent as a virally mediated sort of a cancer-driven process. I think part of this has to do with changing in lifestyle. So there's a reduction in smoking, and what used to drive a lot of these cancers was smoking and tobacco. And now that there's been a reduction in the population in the use of tobacco, smoking and alcohol, now that there's been a reduction in the use of tobacco, not necessarily so much in alcohol, the underlying cause of head and neck cancers is changing more to a virally driven one. What's of interest is it looks like the biology is different in tobacco-related throat cancers versus in virally driven throat cancers, and there's a prognostic implication there. But I think that there's growing knowledge that virally driven head and neck cancers are an increasing public health issue, and it does tend to affect men more than women. Whether we'll see the same kind of benefit in terms of risk reduction driven by vaccines in that setting, I think time will tell. I think it's very clear that there's a dramatic risk reduction with the use of the HPV vaccine in gynecologic cancers and cervix cancer particularly.
Oh, interesting. So I was going to ask you also about the vaccine. You know, a lot of kids are getting the vaccine today, but boys are getting it too. So is it worth it for boys to get it then?
It is, yeah. The vaccine is really gender neutral, and there's recommendation, from public health that both genders are exposed to vaccine, and I think that there is a hope that this type of virally driven cancers, irrespective of the end organ that's malignant, can be dramatically impacted when society embraces the vaccine in total rather than just in women. So in my own family, so I have 2 boys and a girl, everyone's vaccinated for HPV. And I think that there's a hope that the next generation of kids will change the epidemiology of HPV driven cancers.
Yeah. Do you think there's a chance that it could be eradicated?
I think there's a chance that it can be dramatically reduced. There's still an incidence of cancer even in fully vaccinated people, but I think that you could by an order of magnitude this could be reduced.
Yeah. What about adults getting the vaccine? Because I thought you can get it up to age 45. Mm-hmm. Is it so?
Yeah, right. So I think that there's going to be there's an opportunity to vaccinate more mature people. I think that the real hope is sort of for the next generation, but I think that with respect to the immunologic benefit of vaccination, it does extend to older groups.
Mm-hmm. Okay, what about if you find out you have HPV, let's say, and you're under age 45, does it do any good to get vaccinated at that point?
It's a good question. I think the answer is I don't know. So I think that, again, there's so many different serotypes of HPV. There's not a good reason for an immune competent person to not get a vaccine. And I think that there is a hope that one's immune system can be bolstered and prevent, some of the dire consequences of HPV. So it would not be a reason not to get a vaccination.
I also saw that, head and neck, or I guess throat cancer is also not always very symptomatic when it's early stage.
It's correct, and so like many cancers, they sort of sneak up on you, and they often take years to evolve, and it might not be until a cancer is relatively advanced, either in the local region or even worse, distantly spread, that it comes to anybody's attention. So it's important to kind of keep an eye on symptoms. There's a line to walk. Nobody wants to be alarmist and to be a hypochondriac, but nobody wants to be too stoic as to miss a potentially curable disease early in its stage. So, persistent lumps in the neck that don't go away need to be checked out. Changes in the voice that don't go away need to be explained. So, we want to be sure that people are aware of the symptoms that might have an underlying cancer that's driving them.
Right. Yeah, I guess that's the thing. It's like a lot of cancers, I guess, there's just a lot of unknowns. The thing about just not knowing, or not being able to screen efficiently for HPV can be a little unnerving, I think.
I think you're right. A lot of the goals and the dreams of cancer epidemiology have to do with prevention, not with treatment. Mm-hmm. Because I think we'd all like to be able to prevent these diseases rather than have to treat them.
Yeah.
If they're going to be treated, we would also prefer that they're potentially curable and found in early stage. And it's been very difficult across the cancer spectrum, truthfully, to find good screening assessments that will do this very thing at the population level. So there's a few, as you know. So there's colonoscopy, and there's mammography, and there's Pap smears, but there's not much more than that out there. And so I think one of the goals of 21st century oncology and population health is to find better ways of screening the population more efficiently, more cost effectively and to translate into meaningful benefits at the personal level and, of course, at the society level.
I recently received a message from a listener that said, "I love listening to your podcasts, but they make me really anxious." First of all, thanks for your message. I really do appreciate that you reached out and shared your feelings. I encourage any listener to drop me a message or a comment anytime. But I do want to say that the intent of these podcast episodes is never to make anyone feel anxious or nervous about potential health issues. We at RadNet really believe that knowledge is power, and that having as much information as possible is actually the key to living a healthier life. Our podcast is meant to provide you with information that will empower you as a patient. With regard to this episode specifically and all that we have learned about HPV, it's true that there's a really good chance a lot of us have or have had the HPV virus. But rather than feeling anxious about this, we should feel emboldened to talk to our doctors about it, ask questions, ask about what kinds of tests are available to you. Ask for a rectal swab, as Lillian Kreppel recommended. That may not sound very fun, but truthfully, getting cancer sounds a lot less fun. I know I'm planning to ask more questions about it to my doctor. And above all else, you got to pay attention to your body and go to your doctor if anything doesn't seem right. And like Lillian did, if something doesn't feel right and you're not getting the answers you need, get a second opinion. You have to be your own advocate in your healthcare, and having as much information as possible is a part of that, and it can save your life. If you're interested in more information on the HPV Cancers Alliance, you can find their website at hpvalliance.org. And if you want to learn more about the Farrah Fawcett Foundation, their website is thefarrahfawcettfoundation.org. Thanks for listening. If you enjoyed our podcast, please be sure to download Your Body for more great content and leave us a review. We'd love to hear from you. If you want to learn more, visit yourbodyshow.com or check out our social pages on the Insta and Facebook. Search for RadNet California. Your Body is produced by Steve Kramer, Doug Smith, and me, Stephanie Landon. Technical and research assistance provided by Joseph Wilson. Executive produced by Paul Colacchio and Karen Morad, all on behalf of RadNet. Original theme music by Mark Lakeyear. We hope you've enjoyed our HealthCast. Find us wherever you download podcasts.